The following segment is sponsored by the University of Utah Health. October is Pregnancy and Infant Loss Awareness Month. Dr. Bob Silver from the University of Utah Health is here to share support for families. Welcome to the show, Doctor.
Thank you. It's a pleasure to be here.
We're happy to have you. Okay, can you share with us the significance of raising awareness about stillbirth and pregnancy loss, especially here in Utah?
You bet. You know, stillbirth is one of the most emotionally devastating pregnancy complications.
Yeah.
And it happens way too often, about 20,000 stillbirths in the United States each year. And it's way more common here than in other countries with similar resources. And it's more common in Utah than many other states in the country. To be honest, we're not really sure why. Part of it may be that we have so many folks living in rural areas, and often with many health outcomes, people in rural areas have worse outcomes than those with access to tertiary care medical centers.
Okay, interesting. Can you tell us about the University of Utah's stillbirth research program and what steps are being taken to better understand and prevent stillbirths?
You bet. We're really excited that we have a comprehensive Center of Excellence for Stillbirth modeled on centers that were started in Australia. And we're doing research on all aspects of stillbirth to try to be better. If I were to be simplistic about it, there's two things we really have to do. One is we have to figure out a better way to execute the things that we already know. Take the knowledge that we have, but we're not doing a perfect job of it, and doing that with every single mom who is pregnant.
Okay.
Second, we have to discover new things to help prevent stillbirths by finding new things that we don't understand today. And so we're working comprehensively to provide better care for patients with stillbirth, as well as preventing stillbirths in the future.
Okay, thank you for that info. How does the Utah Pregnancy After Loss program provide support in terms of, our mental health and medical care?
Thanks for asking that question, because it's so important. Perhaps the single most important part of care for patients with stillbirth or other pregnancy complications is the emotional part. It's emotionally devastating, and many of these folks have a really hard time with their mental health. There's a bereavement process, and we're learning how to better shepherd families through that process. There's also really high rates of anxiety and depression, a lot of self-blame. And then when they get pregnant again, instead of being excited because they're going to have a baby, they're anxious and they're stressed. They worry that something bad is going to happen. So we're really trying to get better at providing emotional support for patients through this whole process. And so we're partnering with our psychiatry and social work colleagues to provide better mental health care for patients. And there is emotional support available in the clinic through mental health care workers. We've also trained all of the people in the clinic, from every single person that they interact with, how to better support these patients emotionally and to say the right things and to be supportive. And then a really critical part of this is peer-to-peer support. We've got a terrific network of families. Stacy Fletcher is a stillbirth mom who works with us, who's leading this effort. So we can connect patients with other families who have been through the same thing. And that peer-to-peer support is just incredibly impactful.
Thank you so much for this information. Where can we go for more?
You can contact the UPAL clinic or the Utah Stillbirth Center of Excellence, and our contact information is online.
Okay.
And we're happy to talk to anybody anytime.
Okay.
In addition, there are many terrific support groups out there, and Share Patients of Utah, something called Star Legacy, the International Stillbirth Alliance. All of these peer support groups are wonderful for families who have suffered a stillbirth.
Perfect. Thank you so much for the information. It's such an important topic for these people not to feel alone. Dr. Bob, thank you so much. Great to see you.
Thanks so much for having me.